Hello and welcome back. It is Jen with Aging Advantage, and I am so glad that you have joined us for part two of our series here on mood, memory, and meaning. So, Aging Advantage is a non-for-profit organization here in the St. Louis area, and we support St. Louis and also, obviously surrounding area, but obviously this educational content is relevant to everyone, really everywhere for that matter. But we're based here in the St. Louis area, and we help support seniors and disabled adults in the greater area here. Through local grants and donations, we are able to offer programs such as these educational opportunities to help with the effects of post-pandemic situations like housing, food insecurity, also like isolation, and also to help you all, again, just be more aware of ways that you can live healthier lives for yourself and for anyone else around you that you might be helping to care for them as well. Um, we try to provide educational opportunities like this to really help promote self-reliance, self-resilience, and give you guys more confidence to be able to navigate your lives and feel more secure and steady about doing that independently. So, again, today we are going to be going over the second part. And again, if you missed the first part, no worries. This presentation, can stand on its own as well, completely fine. But I do encourage you to go back and watch that one, the part one, when you get a chance as well. So in our last presentation for part one, we talked about the deep connection between emotional health and our brain health, and how loneliness and anxiety and a sense of purpose really help all to shape the way that our brain functions. And in today's presentation, we're going to be talking about, I guess, taking like a further step in a deeper dive, if you will, looking into memory itself. So we're going to be exploring in this part two further what is normal in terms of aging when it comes to memory. What are signs that might indicate that someone is having a little bit more issues that potentially could be a little bit more serious? And, how things like stress and loneliness and depression really can play into that cognitive health. So today, my goal is to help you feel more informed and less anxious overall about memory changes. And again, because, understanding what's normal and what's not normal then will help to kind of give you, or, for yourself and, or if you're, caring for a loved one or somebody around you, like empowering tools to know what things that we can do, for ourselves and also for the people that we love. So get cozy, grab your drink, settle in, and let's dive in to this second part. Let's start here with, again, we're going to start with part two. So part two, we're going to be, again, looking more at these memory changes. And so kind of, again, just to orientate you, memory, to the memory changes and mood that we're doing in the series here. Today, we're going to be exploring really how memory naturally shifts as we age and what signs may signal that there's something more happening and how our emotional health can play a role in cognitive well-being. So think of this presentation, if you will, as your guide to telling the difference between, is that normal aging, or is that possibly worth, getting checked out more? All right. Mhm. On 1 second here. My slides did something funky. Okay. Okay. So let's talk about, understanding memory changes. And again, let's start broad here. So what I, want you guys to understand is really, um, it's completely normal for memory to change somewhat. This doesn't mean, again, that there's something wrong per se. It just means that our brains, like the rest of our bodies, shift over time. And the key here is learning to explore how memory naturally shifts with age and recognizing, again, what signs might be something a little bit more going on, and understanding, again, how that emotional health plays a role in our cognitive well being. And that's exactly what we're going to be unpacking. So let's revisit a quick theme here from part one, but let's go a little deeper. Loneliness is linked to faster cognitive decline, and we know that. And it's worth taking seriously. Here's what the research tells us. Social isolation increases dementia risk. So emotional loneliness disrupts memory and brain function. And reduced social contact limits cognitive stimulation. And we know that. So obviously, when you're not engaging with others around you, your environment, other social settings, etc., it can really have an impact on our brains, again, needing to think, needing to take new information in. We have to hear the information, our brain has to take it in, we have to process it. And then after that, we have to, do some problem solving to discern how we want to react or respond, appropriately, what we want to think about it, whatever's happening, or what other information, has been presented to us. And we also have to kind of problem solve, if you will, and put the puzzle pieces together in our mind, how we want to communicate back to someone else. And I think that, again, is just so important because all of those different problem solving skills, if you will, naturally occur as we are doing social engagement with other people and having social contact. So, again, like I just want to pause on this just for a moment because I know that some of you, might be sitting with a loved one who lives alone. You might have a loved one that lives alone. You might have a neighbor, that lives alone, etc., or maybe yourself. You are actually managing life alone right now. And this isn't meant to cause worry for you, per se, but it's just meant, again, to really just have you guys pause and be aware of what's happening around you in your own life. And again, just to be aware of what's happening in the lives of people around you. It's just meant to highlight really how valuable connection is from a protective manner for your brain. So if loneliness is something that you or someone you love is experiencing, obviously, step one is awareness, right? And then step two is going to be like acceptance, accepting, okay, this is what's happening right now. And again, it's not always what we had planned for or where we thought our life was going to be or where we thought it was going to go. But, a lot of us do find ourselves, alone. Or again, somebody that we love, an aged parent or, even just a family member or someone like that is experiencing that loneliness. And, once you kind of accept that this is the reality of where the situation is at the moment, from that point, you can then have a realistic springboard and opportunities to be able to correct and, change and grow, through that experience. It's not that you're going to be necessarily like stuck in the the loneliness forever, by no means. Again, recognizing it, just becoming aware, and then looking at, okay, how do we get a plan, how do we get a path to get more connected and stay more connected, and know that addressing it, isn't just good for the heart, but it is genuinely good for the brain too. Obviously, being aware that someone else needs more support, that someone else needs more help, and, needs connection. And again, even if that's you, is genuinely a good thing. And just being honest and real with yourself again, and with loved ones around you. And I think also I want to highlight here too, having those real conversations that for some people, it's like they put their pride, aside, or their pride and ego, or they just think like, well, I don't want to bother, someone in my family. I don't want to be a nuisance. I don't want to be an inconvenience. And so, stacking these types of thoughts over time can create a life for ourselves that where we have actually created a life now that we are more isolated, because we don't want to, again, bother somebody else or inconvenience somebody else for certain things. But now we are isolated, no one's coming around, no one's calling, no one's talking to us, or very few times are you actually engaging with people. And and then we find ourselves all of a sudden in a state of feeling, overwhelmingly isolated. And, again, it can be scary, anxiety producing, depressing, and all the things. But again, just awareness, right? Observation and awareness, like, this is what's happening right now. This is where I am. And yeah, I do feel kind of lonely. I do feel kind of sad. I do feel kind of hopeless, or I feel a little bit, I feel a little depressed, etc. Just having those real, honest conversations first with ourselves is step one. But then after that, you have to advocate for yourself. I tell my dad this all the time. I'm like, you have to advocate for your own life. No one else is going to do it for you. No one else sometimes, is going to recognize or understand. Like, nobody else can understand the full gravity of what's happening in your brain, in your body, for your emotions, right? Like, what you're feeling, like what you're going through, what's happening inside your head. And, if you don't have those conversations and advocate for yourself and say to someone else, hey, like, I really am struggling right now. I'm struggling a lot. I feel really lonely. I feel kind of hopeless. I feel kind of sad. I don't feel very cared for, very needed, very wanted, very desired. I don't feel like I have a lot of value. I don't have a lot of significance. I'm just kind of over here in the corner, like, by myself constantly all day long. And you don't actually externally talk and have those conversations and have those awarenesses with people, people won't know how to help you. People can't step in and help you unless if you, again, have the awareness, recognize what it is, accept this is what it is, not what you were planning necessarily, but this is where we are. And then advocate for yourself and say something to someone. Bring it up again to a friend, a family member, maybe one of your, medical team, one of your doctors, somebody at church, a social worker, somebody, anybody for that matter, in your world. And then, together they can get you connected to, more social engagement, to resources, and to tools that can help to get you out of that situation that you are in. Next section here might be one of the most helpful parts of today's presentation because I know that this is a question that many of you have. And I know I did myself as well as, I watched my parents age. So how do you know what's normal and what's not? So we're going to talk about occasional forgetfulness, slower recall, and then also some concerning symptoms. So occasional forgetfulness, if I can remember how to say the word right. Occasional forgetfulness, there we go. But sometimes what that can look like actually in functional terms is if someone's misplacing things or items, or if they're forgetting a name briefly and then they recall it later and they're like, oh, yeah, I remember. Yeah, that guy's name was Tom. Okay, yep, I remember now. Some of those things can just be a normal part of aging. If you've ever walked into a room and forgotten why, or blanked on a name that you're trying to remember, only to remember it later, that's normal. That happens as we age. So that's not necessarily a red flag. That's something, that as an isolated events that are happening by itself is, not something that's like a huge red flag that you got to, do something with mourning, right now. Slower recall. So taking a little longer to remember things, but still learning and retaining new information is typical also with age. So your brain might not work quite as fast as it did at 25, but it's still working. And so that's a good sign. If you can still remember things, that is good. But again, I think a lot of us can be really hard on ourselves because we get frustrated with ourselves, and not only frustrated with ourselves, but we can tend to get highly frustrated then sometimes with other people around us if they don't remember things, like they used to. And I know sometimes even it's like, you're when you're around, again, maybe like an aging parent, for example, or something, and you literally are sitting here thinking like we went over that like literally last week. Like, how do you not know that that's, that's the doctor's name, or, that it was Mercy, not BJC, or vice versa, whatever it was. Like, how do you not remember when you were in the hospital, or how do you not remember your, just different things like a name, etc. And again, it can happen. So I think this is where one of those like, okay, pause. When these kind of moments happen, just kind of pause again, just give yourself grace or the other person grace. And I think, just as a society, a lot of times we can, do some of us is one or the other, but like some people, they can have way more grace, way more patience, way more tolerance for other people in their life that, aren't functioning at peak performance, we'll call it, in just whatever category it is, than they have for themselves. So, it's like I can give you a lot of grace if you, continuously, aren't performing at 100%, and I can be patient with you, and that's fine. But if I, for example, the opposite example would be like, if I, keep like not remembering stuff and I keep screwing things up and, in my own mind, whatever that is, but I keep, forgetting and I keep not doing things right, or whatever. For a lot of people, it's hard for us to be patient with ourselves and to give ourselves grace and, to not get frustrated and angry and mad and all the things like with ourselves. It's easy to give other people grace, again, sometimes, and not get mad and frustrated and angry and all the things at them. So, this again is just one of those like pausing for awareness and observation moments. Just, take a minute to think about where where could these, scenarios potentially like play out in your own life. And again, like maybe who is someone and the who might be yourself, that you need to have like a little more patience, a little more grace with, potentially like in this department. Because, at the end of the day, like we are all just doing the best that we can with what we got in the moment that we, in the moment and that's present right in front of us. And, some days that can look better than other days. Um, Things that can play a factor in this also that we'll discuss more sometime too. Besides, how we talked about like anxiety and different things like that with focus and concentration, but also in terms of our memory and cognition and how long it takes us to remember things and some of these aspects like here we just talked about. For some people, sleep and a lack of sleep for that matter, and them not getting enough sleep can absolutely be detrimental on someone's memory. People, can tend to feel like more brain foggy, you'll hear somebody say, or they'll feel, a little bit like loopy, or some people will explain it as, instead of that, they'll explain it as like they just kind of feel like all day long, like they kind of just have like a hangover or something, kind of a feeling like blah, mentally like that, even though like obviously they haven't been drinking or doing anything to that extent at whatsoever that could have, affected them cognitively like that. And so, again, just being aware of those things, making sure you're getting good sleep. If you need to use a CPAP machine, um, to make sure your body and your brain and your lungs and your heart and all your body parts are getting the right oxygen they need, that is also going to be key. Also, if you need to wear oxygen and you don't, wear it, because again, you're getting oxygen to your brain and your other body parts so that your brain can think right, and your, heart and your lungs and all your other body parts can get the oxygen that they need. And, I think some people, and again, this is doctor warning, no, yeah, Dr. Jenn, public service announcement, warning. A lot of people will do great sometimes, with oxygen at home. Like when they're at home, they'll, hook themselves up, or when they're taking a nap, they'll hook themselves up, when they're in the recliner, but they don't want to take the portable oxygen tank with them when they are outside of the house and I call it roaming around out there in the wild. When you guys leave the confines of where you live and you're just out there doing life, a lot of people don't want to have to take the oxygen tank with them. And okay, I get it. But if you need the oxygen, especially you're going to need the oxygen when you are out there walking around, being more active, again, like engaging mentally and having to focus and having to react and respond and problem solve and all the things like that's, at home is, yes, you need to use it at home. So yes, but please try to make sure that you make it a point to take the oxygen with you when you leave the house, that you have everything charged and you have enough tanks and all the stuff if you do go outside of the house. Okay, public service announcement over. Just kidding. Anyway, I just want to make sure you guys are aware of that, because those things can absolutely cause forgetfulness too, and, memory issues. So, concerning symptoms, the last one on this slide here. So, you know, here's what's different here. Um, And here's kind of where we go, oh, okay, maybe something might be going on that we absolutely now, for sure need to get checked out. So it's going to maybe look different. So maybe like frequent memory loss that really disrupts daily life, confusion, disorientation, or difficulty with like familiar tasks that somebody's been doing for forever, or a really long time, and they just have a hard time again getting all the steps in order or remembering what step goes next, etc. So these things can absolutely signal that something more serious is going on. So again, it might look like getting lost in a familiar place, or forgetting again how to do a task that you've done for years, or memory issues that are noticeably affecting more of that day-to-day kind of functioning. So if you or a loved one is experiencing what sounds like, more than just this kind of secondary category, again, don't panic, but do take it seriously. And we'll talk more about the importance of early evaluation in just a few minutes here. Let's talk about stress, because it plays a bigger role in memory than a lot of people really expect. So stress hormones like cortisol directly impact the hippocampus region of the brain. And that's where the brain's memory center is located. So when we talk about stress affecting memory, it literally isn't just a figure of speech. There's actual real biology happening here. And, here is an interesting nuance also. So short-term stress can actually sharpen focus, which is interesting. And, to think about like how alert you might feel right before an important event, right? So sometimes it's like you get really dialed in, and like you're rushing around to try to get ready. Sometimes stress can actually dial you in and have you functioning a little more optimally in that kind of a situation, in a very short term important event situation. But chronic ongoing stress is a different story. It actually shrinks the hippocampus volume over time, and that can absolutely impair memory function and recall. So this is exactly, why managing stress is essential to protecting long-term brain health. It's not just about feeling calmer day to day. It's really about protecting the part of your brain that is responsible for memory. Let's next talk about depression. So depression is closely related but distinctly different from stress and anxiety. So with depression, you can have impaired thinking. So depression can significantly impair attention, memory, decision making, making everyday cognitive tasks just feel more difficult. So this can look like trouble concentrating, feeling mentally foggy, or struggling to even make small decisions. Hidden cognitive problems. So here's something important. Mood symptoms often mask underlying cognitive problems. And that can make it a lot harder to identify and address some of these brain health concerns. So, in other words, like sometimes depression and memory issues can get tangled together because it's not always obvious which is driving which. And again, we talked about that back in the anxiety section. Same thing. Sometimes, there can be these other things, emotional things that are happening that can mimic cognitive decline. So early recognition. So the encouraging part here really for all of you is this. Recognizing depression early improves outcomes for both emotional and cognitive health, opening the door to timely and effective support. Depression, unlike other causes of memory concerns, is often very treatable. And same thing like with anxiety. So if you notice early signs of depression in yourself or someone you love or anxiety, maybe for the depression part, it's going to look like persistent sadness, loss of interest in things that you once enjoyed, changes in sleep or appetite. Please don't dismiss it as just aging. It's absolutely, worth addressing. The importance of early evaluation. So this brings us to one of the most important messages in today's presentation, early evaluation. So that helps to increase, again, the treatment options and quality of life if we can recognize earlier that something might be a little bit off. So let's break down why this matters so much. So first, early evaluation encourages timely diagnosis before symptoms worsen. And catching something early is almost always going to give you and your care team more options to help get everything back online for you. And also help to get everything back online a lot quicker without it affecting other areas of your body and of your life. Second, it helps to distinguish between reliable causes and reversible causes and also dementia. So this is huge. Many things that look like memory problems, which also can be, we discussed several things, but other examples of this can be even like vitamin deficiencies, for sure here, medication side effects. So there's a medication, for example, the one of the ones that is, common that we see sometimes in older patients, that older patients might take for heart condition, potentially, some of the different ones like that can absolutely affect, your brain cognition. Also, like depression or thyroid issues. But a lot of these things are actually like treatable and reversible. And again, if it's a medication issue, great, bring it up to the doctor. After I started taking this certain medication, then my brain felt a little foggy. I couldn't think quite as well. And, and I'm really kind of struggling and I can't remember things, etc. But absolutely bring it up. And if you can't get a hold of someone at your doctor right away, call the pharmacist. The pharmacist is one of the, I think, least utilized and one of the smartest people on the medical food chain that, again, doesn't get utilized enough. They are a plethora of information, and again, you can always get a hold of one. So wherever you get your medications from, call the pharmacist, and you can ask, hey, can this be a side effect? Sometimes it can be a side effect of you putting two different medications together. And again, from a medication management standpoint, then your doctor can go back and make corrections and help get that fixed. So you don't want to assume necessarily like the worst without ruling some of these other things out, because some of these other things, again, are treatable and reversible. And third, early evaluation supports proactive planning for care and well-being. So whether the outcome of an evaluation is again, like just the whole goal is going to be like having that information to know from a diagnosis standpoint early on, is it dementia that we're actually going to be looking at, down the road potentially? Is this going to continue? What does, in Dr. Land, we call it continuum of care, look like, for this person, etc. But when whatever the outcome is of the evaluation, one way or the other, having that information early gives you and your family more time to plan and adjust and make informed decisions together before it gets really severe later down the road. And then, the person who it might be affecting, if it is actually, like a dementia situation, they're too mentally progressed to where they no longer have a say in, their care and kind of what happens next with them. So if you or someone you love has been putting off having a conversation about memory concerns out of fear, I hope today's presentation offers a little encouragement for you all to like take that first step. And again, knowledge really is empowering. So as we close out part 2 today, let's recap what we learned. We are going to have a part 3 for you all coming up. But for today, as we close out this part 2, just a recap. We talked about the difference between age-related memory changes and symptoms that might warrant a closer look to see if you have something else going on. We also explored how stress and depression can affect memory and cognition in different, distinct ways. We talked about why early evaluation absolutely is key, and matters so much. And again, not to cause fear or panic or, more anxiety or something like that, but really by being able to get an evaluation and know the outcome earlier helps to open doors. And think of it that way, for more support and treatment and peace of mind. So in our next presentation, we were going to do a part 3 for you all, but we're going to shift towards something practical and empowering. So we're going to talk about ways to boost your mood and your memory, and we'll talk about activities and habits and everyday choices that genuinely support brain wellness. So I think you're really going to be enjoying, those topics as well. And again, we're going to look at practical ways that you can implement things to help support and keep it moving along in the positive direction in this area. So again, thank you so much for spending time with me today here. And if this presentation was helpful for you, please follow Aging Advantage on Facebook and subscribe to our YouTube channel so you can catch all of the rest of this particular series, parts 1 through 4, and also all of our other incredible education topics and information that we have for all of you. So thank you again. Take care of yourselves, and we will see you all in part 3.